Is now joining.
That wasn't a thread.
Participant is now joining. 2 participants are now joining.
Courtney Franklin
Is now joining.
Rachel Gano
Is now joining. Unknown participant
Kristen Holland
is now joining.
Mike Milligan
Is now joining.
Rachel
Is now joining. Two participants are now joining.
Daniel Billingsley, Center for Nonprofits.
Is now joining.
So we may have another person or two join the call, but is Sid on the line? Okay, Margie?
Sarah Robert
Is now joining.
Good morning.
Good morning.
Good morning. Natalie Karn.
Is now joining.
Kathy Laster
Is now joining. Two participants are now joining.
Margie Preston.
Is now joining.
Molly Helm
Is now joining.
Did Sid join?
Sid's here.
Oh, great. Okay. Ignore my email. So we may have a few more people join the call, but out of respect for everybody's time, because I know there's a lot going on, we'll go ahead and get started. So just a couple of housekeeping notes. What I'm going to do is ask the panel to introduce themselves, and then after that, if each funder member would introduce themselves and their organization, just so that we, as we're coming together and getting closer as a group, so we know who's on the call. And then I'm going to ask all the funders to mute, and we'll let the panel kind of answer some questions. And if you do have any questions for the panel, if you could email them to me.
Unknown participant is now exiting.
Then
Is now joining.
if if you could email any questions to me, then I'll kind of manage those questions for our panel. So we'll go ahead and get started. First off, thank you everybody for taking time to come together and visit. Hopefully we are coming together closer as a funders group and learning how to
Unknown participant is now joining.
coordinating our giving so that we can maximize and leverage our
Is now joining.
resources and provide the greatest service to our communities and our needs. So with that, let's see, just going to kind of go down the list. Our panelists this morning, Debbie, can you say good morning?
Good morning, Debbie Hampton, United Way.
Okay, and Cassie?
Good morning, Cassie Gilman, Regional Food Bank of Oklahoma.
Okay, Sid?
Sydney Ellington, Oklahoma Red Cross.
And Margie? Margie?
Oh, good morning. Margie Preston, Heartline.
Okay, great.
Sorry, I had it on mute.
Oh, too early. Yeah. And so don't want it to just be all at once, but let me see. I heard if funders want to introduce themselves so we know who's on the call.
Molly Helm.
So we've got Kim and Molly.
Hi, this is Louisa McCune from Kirkpatrick Foundation.
And Chris Spice.
Frank Merrick.
Foundation.
Hi, this is Kathy Lasser from Avitas Foundation.
Athena Grossman, Kirkpatrick Family Fund.
Mike Milligan.
Chris Starkey Foundation.
Natalie Carnes with Starkey Foundation.
Jean McLaughlin from McLaughlin Family Foundation.
Mike Milligan with the Robert Glenn Rapp Foundation.
Christina Raykoff with Devon. Wendy Sherbeck
Carrie-
of America.
Liz and
Gary
Tim McLaughlin from the McLaughlin Family Foundation.
Courtney Franklin with Love Strap.
Rachel Goodnow with Chesapeake Energy.
Lindsay
Kelly
Davis,
Laughlin Family
Chesapeake
Foundation.
Energy.
Sarah Roberts and As Much Foundation.
Tyler Kukarzik and As Much Foundation.
Alpha Price and As Much Foundation.
Carrie
Merrick.
Holland
Foundation.
Foundation Management.
Kimberly
Jessica
Cope
Gilmore.
from
Is
Sonic.
now joining.
Hey everybody, Lindsay Laird from the Arnold Family Foundation Fund.
I promise I'll
Kim
figure out a way to
Preston, Lucia.
coordinate this better. Who was the last person?
It's Brooke Townsend from Blue Cross and Blue Shield of Oklahoma.
Great.
Kristen Holland with Boeing is on. Jessica Gilmore with Express Employment International.
Dan Billingsley
Christy
with
Woodward.
Center for Nonprofits.
Is now joining.
Christy, good morning.
Hey, good morning.
You're so good. You've got yourself muted. Thank you. Anybody we've missed? Okay. And I apologize for that. I'll figure out a better way for everybody to introduce so that we know who's on the call moving forward as we do more of these. But thank you for letting us know that you're here and participating in the call. So I think what we wanted to do this morning was ask each of our four panelists to share with us the needs that they are seeing emerging, and then gaps in funding and gaps in service provision. So, and then whatever else they feel like they should share with the group. So I'm going to go ahead and pick on my good friend Debbie Hampton and let her go first. So Debbie, can you kind of share with us what's going on in your world?
Happy to do it. One of the things I'll start with is just giving you a broad overview. We do a daily situation report or situational report. We call it our SIT report. So I'm going to report off of today's most current numbers. We are meeting with, virtually meeting with 73 nonprofits. We regularly fund 73 nonprofits in Oklahoma with United Way of Logan County, United Way of Canadian County, and United Way of Central Oklahoma. That equates to 155 programs. We're also part of there are 18 United Ways in the state of Oklahoma.
Is now joining.
State CEO group is meeting regularly as well, and we're trying and doing really pretty darn well virtually, coordinating statewide efforts. And United Way of Central Oklahoma is also part of a national CEO group that is also meeting regularly to see if we can pick up ideas and projects across the nation, especially in states that are at this point harder hit than ours, and what's worked and what hasn't. So from United Way's standpoint, our biggest goal with our COVID-19 response fund is to make sure that our 73 agencies have the resources needed. And I think, honestly, our 73 nonprofits are going to be also probably applying to all of you that are on this call, because they're going to need it this time. What I'm seeing from our agencies, and they're reporting to us constantly, but what I'm seeing is their business is booming, and they're having to add technology and telehealth and all types of equipment so they can still respond to their clients that they're serving. A lot of our agencies, quite honestly, are finding ways to be as safe as possible, but still distributing food and much needed basic items for those shut-ins, and some of the working and coordinating really well. Probably the biggest worry I'm hearing from our CEO group is we have agencies that their staff have tested positive, and then that individual has been throughout their entire building, so they're having to shut down for 14 days and try to still provide services virtually. They've had loss of income right now. They're not getting the revenue that they typically would get from charitable dollars, especially from the corporate world, because the corporate world is going through the same things that the nonprofits are going through. Their nonprofit, the only difference is our nonprofit business as it relates to clients is booming. I'm receiving, United Way is receiving, and I get a lot of these emails, but some very dire need individuals that are not your typical client. They are people that have never asked for money before. Typically, they've given to a United Way employee campaign, and they're reaching out to us desperate because they've been laid off. They have no PTO. They've had no payouts. And I know we have the stimulus package, but there are going to be some real gap fill areas until that money starts flowing. We have currently in our COVID response fund $280,000. We are also not charging admin fees for those funds that are coming in. I'm going to be real honest. I anticipate us possibly getting up to $500,000 in that particular fund, but I'll keep you as informed as I am. Currently, we have 19 requests from our 73 agencies. Their requests total $336,858. I'm looking at one other piece, and then I can move on. I can tell you that we're in the middle also of our site visits for our regular allocations, which you might imagine has been a challenge. We have over 20 allocations committees. It takes just over 200 volunteers to do that allocations process. We have really tried to narrow that down. Normally, we do site visits. We spend hours with that agency as we're looking at financials and such. We have cut that time limit to 30 minutes per agency because most of our agencies are in the midst of responding to this disaster. The advantage we have with these 73 nonprofits is we know them really, really well, and they've been vetted. And we're working very closely not to interrupt any service delivery as we're doing the allocations process. I cannot say enough good things about what the nonprofit sector is doing right now. Probably one of the things I'll leave it with is I hope, as we have this conversation, I really hope that one of the foundations on the call will possibly consider funding maybe 2 or 3 folks that really understand this stimulus package and can help our nonprofits apply for that funding, because I think it's going to be critical, whether they're small or large, that they apply for those dollars. And Teresa, that kind of concludes my report, unless you have anything else you'd like me to talk about.
No, I think that's great. Thank you. And remember, if you've got any questions, just email me, trosecrook@cfok.org. And once we go through each panelist, then we'll go back and ask questions. Thank you, Debbie. So next, Cassie, if I can ask you to give us a report for the Regional Food Bank.
Sure. Good morning, everyone. Thank you for letting the Regional Food Bank join you on the panel today. For us, similar to Debbie, we have a situation team. Our incident commander right now is on a call. We meet every morning at 8:30. We have 2 meetings a day. We have a liaison that's working with the State Office of Emergency Management. So he's actually going on a call at 9 a.m. this morning and hope to have more information. But for us, what it looks like is we're boots on the ground. Debbie knows this from her experience with the Red Cross, making sure that food is getting out to our existing clients. Right now in our agency network, we're seeing most of our agencies are remaining open. So we have nearly 300 community-based partner agencies that are operating right now in the 53 counties we serve. On our daily call, we do speak with our counterparts that are part of that call in Tulsa. So our peers at the Community Food Bank of Eastern Oklahoma, our needs are about the same. They are in more of a desperate situation right now for food. So let me give you kind of a little, if you may know, and I apologize for those of you who understand the way the model works for the food bank. The food bank really relies on waste in the system, in the supply chain, and our supply chain is in flux right now. This is not happening at a local level, it's really happening at a national level. And we're part of a national organization called Feeding America. And in fact, our former CEO is heading up as Chief Operating Officer for Feeding America and is keeping us briefed on what's going on a national level. So what's happening is that manufacturers are bypassing wholesalers and going directly to retail. So typically our agencies, I'll give you an example. I heard someone from Avitas is on. So in Shawnee, we have our Community Food Bank of Pottawatomie County typically gets retail donations from Walmart, from all the local grocery stores, Homeland. That has completely dried up for us. So we have shifted our model in order to accommodate the 60,000+ families we serve on a monthly basis. We are assembling emergency boxes. Those boxes are typically assembled through our volunteer workforce. We closed off operations to volunteers 2 days ago. So we're utilizing, we only have essential staff here in the office, and so that is our warehouse employees, our transportation department, and our volunteer coordinators, and then several members of our incident command team. So we have asked the state through the Office of Emergency Management for assistance in assembling and distributing those boxes. We should hear, hopefully this has been going on for about a week over the weekend. We've asked the governor to, or asked him if he would have an interest in calling up the National Guard. My contacts at the National Guard tell me they're ready and waiting. They just need to get the approval from the Office of Emergency Management. So what does this look like for us in the future? Similar to what Debbie mentioned about their agencies really seeing they're booming for business is how I love how you put that, Debbie. Our agencies are booming, and that I'll give you an example. Our Food and Resource Center in Moore, Oklahoma, I worked there on Saturday distributing food. We saw 25% additional clients, brand new clients, similar to what Debbie's seeing with the United Way. And same way, we typically will charge handling fees on any food that comes out of the regional food bank. Partners don't actually pay for food, but there's a handling fee in order for us to transport that food and get it to their agency. Those handling fees are being waived right now. And because we're not getting donated product of food, we do have a little bit coming by way of USDA, and we anticipate getting a little more. But in the interim, we've had to purchase food, and the disruption in the supply chain is requiring 4 to 6 weeks before food is supposed to get to the regional food bank in order to pack and distribute. So our challenge right now, we did have a little ray of sunshine yesterday afternoon. We had placed a large food order on the Friday before, and we heard yesterday that truck that they had said would be 4 to 6 weeks, those trucks, plural, will actually be here starting this Friday. So our needs are great. To kind of put this in perspective, we received a very generous $2 million gift, as many of you may have read. That $2 million will only buy food for about a month. So and that's assuming current operations feeding the 60,000 plus families we do in our network. So I'll pause there and let you guys go to the next panelist and be open for questions.
Cassie, thank you. Sydney, would you share with us your update from Red Cross?
Absolutely. Thanks for having us on this call. I've also got Holly Rowland is on the call, so she may add, additional perspective. We're all working from home. We closed the Red Cross Central Office about a little over a week ago, and started all working remotely. Since March 15th, when the mayor installed his first proclamation, we've responded to 13 fires. We've distributed almost $4,000 worth of immediate emergency funds. We've supported 23 people that were affected by home fires, and we've opened 5 cases for folks that need follow-on assistance, and that'd be health services, further financial assistance, and the like. With the Red Cross, we always ask for either your money, your time, or your blood, or all three. Right now, our national headquarters back in Washington, D.C., has declared the COVID pandemic a level 7 disaster. And I know Debbie Hampton knows exactly what that means, but level 7 is as high as it gets. So think of an F5 tornado. So the expected outlay that the Red Cross across the nation is going to have to contribute toward this outbreak, we're expecting in excess of $100 million. The Red Cross provides 40% of the nation's blood, and we've had across the country over 6,000 blood drives canceled, and that's growing. And those are canceled by hosting institutions and organizations because of the COVID-19 pandemic. Money, I've covered blood. The other, big need is time. A lot of our volunteers, the Red Cross, 90% of our workforce are volunteers, and 90 cents out of every dollar goes to help those who have been affected by, disaster. And a lot of our volunteers are of the vulnerable population. There are a lot of retirees, many folks over the age of 60. And so as this thing continues to spiral, one of the things that we're trying to plan for is reaching the event where people, our volunteer force, are uncomfortable in responding. We've already had several people, we're keeping documented lists of who can respond, who feels comfortable, who doesn't feel comfortable responding. And that list of I don't feel comfortable responding at this point is beginning to grow. We've put in place, new procedures and protocols as it relates to responding to things like home fires. We've got the masks, we've got the gloves, we maintain the 6-foot distance, and technology has given us the wonderful ability to stand back away from someone, ask questions, and put the information, in an app on a cell phone, and then leave the money, set an envelope with funds in it in the form of, it looks kind of like a credit card, but load that up remotely, set it down, and then the individual, affected, can come and pick that up. So the system's working. One of the things that we're, concerned about and planning for in central Oklahoma would be, a big disaster in light of all of this, that's going on. With that in mind, we're maintaining regular communications with organizations like the Oklahoma City Emergency Management, Oklahoma City County Health Department, the governor's office. And like I said, we're trying to prepare for that severe weather response. Another concern of ours is should we have, an illness, should someone contact COVID-19, that is either, one of the paid staff members, which we don't have many of, or one of our key volunteers. It takes a lot of training and experience to be a Red Cross volunteer, especially in a leadership role. And so should that happen to some of our key volunteers, who have a lot of experience, who have been with the Red Cross for many, many years, that would be a pretty devastating blow as far as our ability to respond, locally. I'm going to reach out to Holly Rowland, who's also on the call. Holly, is there anything else that I missed or maybe that we need to add?
I just came
Holly?
off mute. Want to make sure you can hear me.
Yeah,
Yep,
we can
we
hear
gotcha.
Okay, perfect. I think you did a great job in covering the big concerns that we are watching and monitoring as this coronavirus pandemic continues to evolve and develop, especially in Oklahoma. One thing that I will add is in needing to find an alternative way to continue our mission delivery and continue our disaster response is we are going to have to invest a little bit more heavily into the virtual space and the technology that will allow us to do a lot of the response and recovery case management long-term, still without that personal contact, in case these social distancing enhancements continue or even progress throughout the state. Things like mental health and counseling services digitally, or even that financial assistance delivery in a virtual space as well. We're exploring all of those things. Also, to go back to the critical need for blood, nationwide, we're hiring about 1,000 additional phlebotomists because universities, businesses, corporate offices, and community centers are closing to mitigate the spread and even the containment of coronavirus. We are having to activate more phlebotomists to travel further to collect fewer units just to maintain the supply that's needed with some of our hospital partners. In Oklahoma, we have about 14 hospital partners, and we are working alongside them every day to ensure that what we have available in the state is adequate for their patients and those life-saving procedures that, because emergencies still happen and those life-saving procedures are still going to occur even amid the pandemic. So those are just some additional things that we're seeing in needs from our side. So Sid, I think you did a great job. Thank you so much for letting me just add a couple of words. I appreciate it.
Absolutely. And just to piggyback on, what Holly brought up, as it relates to the blood drives, the impact of these massive numbers of cancellations across the country, considering, again, that the Red Cross provides about 40% of our nation's blood, we are looking at it. It's not about having blood drives this week. It's about staging them out for the next 30 to 90 days to try to recover. So far, I've had, some great response. The mayor Kathy Cummings
is now exiting.
Mayor Kathy Cummings of the Village is going to host a blood drive at City Hall. War Acres, Del City, Midwest City, city managers have all, pitched in and said, when can we hold a blood drive, in our area. So, again, not a blood drive next week, but maybe a blood drive 30 days from now. And that's kind of, how we're working. So again, just to wrap up, our needs, level 7 disaster, and we'll need the funds to, support that and respond. Time, we need more volunteers because so many of ours are in, in the at-risk category. And then blood, any help
is now joining.
And then blood, any support we can get hosting blood drives would be greatly, greatly appreciated. And that kind of wraps up, my report. Back over to you.
Okay, great. Thank you. And
Unknown
thank you.
Participant is now exiting.
A number of you have sent questions in, so thank you for doing that, and please feel free to continue sending them to me. And so our fourth panelist, Margie Preston. Margie, can you, can't imagine how busy your group is right now, but if you can give us an update on 211.
Sure. Yeah. Thank you so much for the opportunity to represent Heartline today and to talk more about our 211 service and what we're doing in the community right now. With 211, it's been really, this past week and a half has definitely been a whirlwind. We started out working with doing a contract with Office of Emergency Management for the individuals that were actually quarantined that came from the ship. We started providing resources to them, and then we're doing follow-up with them to make sure that they have everything they needed while they were under quarantine, and then reporting back to Office of Emergency Management for that. And currently we've added, the largest thing we've added is the Oklahoma State Department of Health, and working with the governor's office and DHS and Oklahoma Department of Mental Health and Substance Abuse Services. It's kind of a collaborative partnership to be answering the COVID-19 hotline. So when it first went out, of course, they, wanted to have medical professionals answering that line and the nurses to provide, that medical support. And they were so inundated with the amount of calls that came through. After a few days, they contacted us and said, hey, will you guys help with this? Because there's so many other questions outside of just medical issues, obviously. So we are actually answering the line, and on the front end, it gives you all kinds of different options. And so we have a lot of people that can, streamline and get some of those options right up front. And then the others are coming into our agency, and, we're just providing the resources that individuals need, and we're, busy with our database. It's just a huge process to keep everything updated, and the agencies and the communities have been really great about turning in all the different services that they offer and just helping along that way. And then another component that we are adding right now, it'll probably be by mid next week, we'll be up and running with that, but we're going to work with Oklahoma Department of Mental Health and Substance Abuse Services, the prevention team, and we're going to actually be able to not only transfer to the nurses with the State Department of Health, but also we'll be able to transfer for mental health support as well. So we're really excited about that option because we're getting a lot of calls where people are, they're not just concerned about I have symptoms and I need to know where to go to get testing, but also, there's a lot of concern about, not your actual employment and, how am I going to pay my rent and I'm not working. And then concerned about, their elderly parents. And so there's like a lot of stress around, just emotional health. And so we're going to be able to kind of triage those calls where 211 will be doing the direct. This is our, our services that we're offering for all the resources that we have and the latest kind of resources that are coming in. And then working with, we're forwarding calls on to the nurses and the medical professionals if it has to do with a medical issue, and then being able to, starting next week, send calls on for mental health support as well. So we're really excited about being able to do that. The amount of calls and trying to ramp up for Heartline has been really challenging. I know some of you are supporters of Heartline, so we appreciate that. And you've been to our building, and we have a very tight quarters for our call center, and we make it work, and it works great. But because we've had to ramp up and hire temporary staff specifically for the 211 line, we are, trying to be conscientious of the space. And so we've taken over the conference room, and we have offices, set up in there, the desks set up in there, 6 feet apart. And then in our actual call center across the hall, we have everybody spread out there. And then we have 6 people working remotely right now. So, and you don't think about all the things that have to go into that. And with the other disasters, we've never had to send 211 staff home to answer those calls. So it is a different kind of situation where we've had to get more computers because we've had to, hire all these new staff, and we've, headsets and the BIOP system, and just so all these different things that you don't think about that we've had to kind of ramp up and get going. Just to give you some of the numbers of what's coming in right now. So it was on the 19th that we started taking over the line for the COVID-19 hotline. And since then, statewide, we cover 40 counties, and 211 in Tulsa, the Community Services Council, has the other 37 counties. And we split that, but then this past year, we started doing the actual statewide. So we have a contract with 211, the eastern side of the state, where we actually end up taking their calls too. So after 8 o'clock in the evenings and weekends and all holidays, we're covering statewide for the 211 service. So we were really finding out that, that we are actually 10,100, as of last night, there were 10,000 calls, 175 calls that came in to our, specifically just to this hotline. So, and that's in 1 week. So that's a lot of calls coming in. Sometimes people can get the information that they need, or they don't want to wait in queue. And so we ended up serving 7,000, like 7,200 of those individuals we were able to actually have a conversation with. We're finding that people were on the phones with people 3 to 5 minutes on average. And, we are actually in our program itself within 211 Heartline and answering after hours for the whole state, we took over 4,100 calls in the past 7 days just from this line. So as you can see, that's, a lot of calls coming in, a lot of concerns, and people needing a lot of resources. And so some of the top needs that we're seeing in the community are utility assistance and food pantries and unemployment insurance. Those are the top 3 so far of what the calls are coming in about. And then people also are looking for rental payment assistance and community clinics information and just public health in general. And then also training and employment programs. So as you can see, it's kind of a variety that people in the community are wanting resources for. So as far as our needs go, I think always, for us, the infrastructure and just, our building and space capacity has been a really big problem for us as we have grown and taking on more lines of business, that have to do with resources and follow-up services. And like we're the centralized intake for homeless services. And so we do a lot of different programs. We run the National Suicide Prevention Lifeline. And it's kind of interesting, the Lifeline has really, as soon as the governor made his first announcement the Sunday before last, that Monday night, our suicide line literally doubled in the amount of calls that came in. So, you don't think about all those other aspects of it, but it's certainly, the concerns around those kind of issues too, we're going to see more of the mental health aspect. So we're really excited, to partner with ODMH. So we're happy to be able to do that with them. And they also support the Suicide Prevention Lifeline. And just really our biggest thing has been that we've had to, get equipment and, everything from computers to headsets and just quickly ramp up within a week, getting additional staff in and the training that's involved with that. So we're just really, it's about equipment and services and just, we're always wanting and needing data reporting, faster options, so that we can really have the tools that we need to document our impact. So that's kind of what our needs are. And trying to think if there's anything else, it's just an enormous scale, and the impact that it's having. And so we're just happy to be part of the system and be able to help with it.
Fantastic. Thank you. So I've got several questions here, and I'm going to start actually with Margie. So Margie, so you mentioned the numbers, but do you know the percentage increase in the number of calls since you've taken over the COVID-19 response?
So the number of calls that are on that particular line, is that what you mean, or are you talking about from Heartline in general?
Heartline in general, but the percentage increase. So for those of us who aren't familiar with your, day-to-day number, average daily calls, how does that percentage increase look like? Or what does it look like?
So we actually have that completely separated out. So our 211 phone line, whether we're doing chat services or web services, or, we have so many different options how people can access resources. But our actual phone line for 211 is still operating the way that it is. So this is literally a different line. So we're completely tracking these. So our average calls of 400 to 500 a day that we're taking for 211, this is an addition because it's a completely separate line. So that's how this is tracked. So the increase is actually all of those calls that are coming in because we're running it as a different line internally, behind the scenes.
Unknown participant is now joining.
Okay, got it. Okay. Thank you. And Sydney, so I had a question, or had a call, or had one of the callers ask the question, where can they give blood now? So where are blood drives being held or standing locations?
Thanks for that question. Our standing location, we've got two. The Red Cross building, although the chapter has been shut down, the Red Cross building in Norman, and I can share that address. I don't have it on the top of my head, right now. We hold a blood drive twice a month down there. And then this coming Saturday, in just a few days, we will be holding a blood drive at the Oklahoma City Red Cross chapter. And the address there is 106 Northeast 6th Street, just off of Lincoln Boulevard in Oklahoma City. And so if you think of where OBI, Oklahoma Blood Institute, is, and the University of Oklahoma Medical Center campus in Oklahoma City, we're just south of both of those, just off of Lincoln Boulevard. But we will be hosting a blood drive in our building from 11 a.m. to 5 p.m. and walk-ins are welcome. Blood drive, blood collection is going on every single day at the Tulsa Red Cross office, which is where our blood hub is for both Oklahoma and Kansas, our region. But I will be sharing more stuff out on Facebook, and I'll make sure that Debbie Hampton knows as more blood drives are being scheduled. We've got another one coming up, tentatively scheduled for the 17th of April at City Hall at the Village. And that one, the logistics of that one are still being worked out. And then we're in contact with Midwest City and Del City and War Acres about holding blood drives in those areas as well. And I will share that information, with Debbie Hampton as the logistics all get worked out and the times and locations get confirmed.
Got it. Okay. And I'm assuming that those blood drive locations dates will be on your website as well.
Yes.
Okay, great. Thank you. And I had invited someone from the Hospital Association to join us for this call today, but they are a little busy. So asking if any of the panelists know what the hospital or medical facility needs or how their situation is at this point. I don't know if any of you are in contact with Patty or anybody there.
Debbie, do you talk to, this is Cassie. I do keep in contact with Patty, but I've been in contact with OU Medical Center since they're the only Trauma One center here in the state, and they were going over their funding priorities on Tuesday and getting back to us. But clearly, I think what's needed are beds. And so beds and supplies, that's statewide. But maybe someone on the call has more information about those two hospitals they're going to recommend patients go to who have been diagnosed with COVID-19.
Teresa, this is Debbie Hampton. We've had conversations with Hardy Watkins at Integris, but it's been more for the influx of what type of vulnerable populations that our agencies serve and how it's going to impact the hospitals. And so I do know that Hardy's had several conversations with Dan Strawn at the Homeless Alliance.
Okay. Well, and that may be one of the items at the end of our call, kind of our working group, our funders group, is having continuing calls like this, and perhaps we can get somebody from the Hospital Association on our next call. So let's see. I think I've had several people ask, and Dan, if you would jump on and give us an update on the second federal stimulus package. And then I think from there, we probably want to have a little conversation around how funders might be able to follow up on Debbie's recommendation of providing some assistance to nonprofits as they're trying to apply for those funds. So Dan, if you could give us an update, please.
You bet. And one of the things, this is actually the third stimulus package. So I'm going to refer to two. There was the second stimulus package, which was approved last week, and there are two major components of that for nonprofits. The first is it's the Families First, and there were changes to sick leave and HR policies that are in there. We're recommending that if you have significant questions about that, you should be in touch with SHRM, which is the HR Society, because they are picking apart everything and letting people know what both businesses and nonprofits need to be doing. Also, there is a white paper circulating from McAfee and Taft exactly on that. So I just want to let all of you know that if you've got questions, it has some significant impact on sick leave and unemployment. So you may want to take a look at that. The second piece of the second stimulus package was, and Cassie Gilman will know all about this, there was a lot in there about SNAP and extra food benefits for the elderly as well. And there is the Unemployment Insurance Stabilization and Access Act that will help people get to their unemployment benefits faster. They have already announced at the state level that those unemployment, the 2-week waiting period has been waived. Obviously, with the nonprofit sector, we want to try and keep as many employees on board, which is what I'm going to go to our next piece. The third stimulus package has been passed through the Senate. It was passed last night. It had been held up by 4 senators, but it did get passed. It is now off to the House. I have already been in touch with Representative Horn's staff. Their expectation is that the House is going to expedite this bill through. That's a double-edged sword. One reason, because they want to get it out to people as fast as possible, but we're not going to be able to add anything in the House version. The Senate version, I'd like to thank, and I think funders and nonprofits should be thanking Senator Langford's office. He was able to get a lot of provisions in there to help nonprofits. He also attempted an amendment that would create a universal charitable deduction with a cap of up to $4,000 on it. I want to just tell you a few things about this bill that are important for nonprofits. The first and foremost is the expansion of SBA, or Small Business Administration loans. And that is through what is called the 7A program. For nonprofits, this is going to be an incredibly useful tool, because instead of it for nonprofits being just a loan, that loan could end up being forgiven and it turns into a grant. And that is to help with up to 4 months of payroll. The idea is that those loans would make sure and keep people employed during the heightened part of this crisis. I'm going to send Teresa a full fact sheet on all of this, so that way she can send it out to you all. But the SBA loans, I would let nonprofits know that their best opportunities are going to be through these new 7A expanded loans. All right. There are other SBA disaster loans that are available to nonprofits. What we're going to say is we do not have clarification around certain nonprofit eligibility for them. We've actually gotten multiple contradictory statements from the SBA, both in Oklahoma and at the national level. So we're trying to get them to create a fact sheet that we would then supply to all of the nonprofits in the state. The reason it's contradictory is that they use a term called private nonprofits versus public charities, private foundations, et cetera. And also, they're looking for nonprofits who have earned income streams. So we're just trying to get some of this terminology worked out to make sure we know who is eligible for those loans. The final 2 pieces I just wanted to let you know from the center's end. One of the questions that we're getting a lot is on this essential businesses definition. It's still a bit vague through the governor's office. What I will say is that if nonprofits
is now exiting.
If nonprofits are taking care of people, taking care of animals, they are going to be deemed essential businesses, but it's not very clear cut. There is an exemption that we can apply for to make sure that we are essential businesses. We'll be sending more information about that in the next couple of days. And the final thing is we are having a call with Representative Horn tomorrow at 2 p.m. And then next week, our call on Wednesday at 10 a.m. will be with Justin Brown with DHS. So just let nonprofits know to keep an eye on our website and in our email blast, because we'll have a ton more information. The final thing I will say is that the nonprofit sector, and we've had conversations with various funders, I think it's going to be incredibly important that we try to utilize as much of these benefits as we can to lessen the burden both on
Unknown
nonprofits
participant
and
is
the
now
funding
joining.
community. Christian Cassie was on a call I was on yesterday and made the same assertion. We are really going to have to depend on any of these benefits for all of our nonprofits, and also to make sure that the burden is not put on philanthropy.
Yeah, outstanding report, Dan. Thank you. And I'll just add that. So I had a call with a bank officer
is now
yesterday,
exiting.
That is over an SBA division, and he was talking about, he said, go ahead and get yourself prepared, start thinking through pulling together data or pulling together your information to be able to apply. And so I think, so just from my perspective, back to Debbie's suggestion, maybe off of this call, but some of us can come together and think through how we can best provide support to the nonprofits, because those processes are not necessarily simple or easy, but also helping organizations understand their eligibility and how to most efficiently get the most of the federal dollars to our nonprofits in Oklahoma. So couldn't agree more with Chris's statement and your statement as well, Dan. So I'm looking through my list of questions. I don't see any more. I'll just open it up. If anybody has a question for the panel. Okay. We will ask for the speakers if they referred to a white paper or any links to any of the information or dates of blood drives, etc. Ask them to send them to us, and then we will email those out to everybody in the funders group. So a couple of last closing items. I do think that this is a good format for us to be able to get a lot of information out as this situation evolves and is changing quickly. So if you've got any ideas about or things that you would specifically as a funder like to see us address, please let me know. And as I said earlier, we did record this session, and we will post it on our website as well as send out a link to the funders group. So if there's nothing else from the group, I want to say thank you very much for your willingness to collaborate and coordinate, and look forward to follow-up conversation about how we can utilize the information the panel gave us today. Anything further?
This is Sid Ellington from the Oklahoma Red Cross. Are we going to think about maybe having a regular, just kind of a meeting, every couple of weeks or so, or are there any thoughts along those lines?
Yes, my thought, and I'm going to craft an email out to the funders group and send this out, but yes, having maybe even a weekly or bi-weekly call that covers different topics, but then some of, as your organizations or some of the major providers of services, having a recurring touch back with you as we go through this time.
Is now exiting.
That'd be fantastic. Yeah, that'd be fantastic. Thank you so much.
You bet. I can't imagine how that would streamline the number of calls that you have to individually make, but then also get information out as quickly as possible.
Teresa,
Yes.
this is Kathy Laster with the Avitas Foundation, and one of the things that we're struggling with is child care. And the question is, they're not actually on the list, child care workers, can there be child care facilities that stay within all the guidelines of space and numbers to help with essential workers' children? We're trying to find an answer to that.
Kathy, this is Cassie Gilman. I don't know about Shawnee, but in Oklahoma City, and we're working with DHS to provide the food, and I didn't even talk about our kids programs, but the YMCAs and the Boys and Girls Clubs, we're providing the food. They're staying open for first responders' kids for childcare.
Yes, I'm aware of that, and we're doing that, but what about essential workers' children?
So healthcare workers, others, is that what you're considering, or people that work providing food?
Well, we already, not just food, child care. We already provide free child care for healthcare workers and first responders. But what kind of child care can be made available to essential workers who are still working who have children? We're trying to find out if the YMCA here in Shawnee has the capacity to expand and to provide that child care, but they're trying to find out if they can. So I just wondered if anyone knew yet what the answer to that question is.
I hate to say I know because I don't. Debbie, you're going to jump in. I was going to say we have a call with Justin Brown, but Debbie, you may have more recent information.
Well, probably, I think we're all collaborating on that together, but the United Way in Shawnee as well as, it's kind of interesting because our United Way covers part of Pot County and then Shawnee United Way does, and we work really, really closely, but we're looking at exactly what's been said, and I can't even tell you how well we are working, and always do, but really right now working really, really well with the Regional Food Bank, which is not a United Way agency, but incredible in every disaster. But I have to tell you, we're trying to work from the staffing side of it as well as the food bank is bringing in the food that is needed. Our agencies are used to working with their regular clients. This comes back to a client base that is not used to asking for help. So what we're trying to do is work through 211 on everything. So as in rural Oklahoma or anywhere, as there is a service provided and as these after-school programs scale up to help federal workers, all essential workers, it's going to be all the resources will be listed on 211. And I don't know if Margie wants to add to that, but there are plans with all 18 United Ways are dealing with their agencies right now. If they haven't already put those plans in place, they will. And they're all notifying and keeping 211 informed moment by moment so the word can get out. So the best way to get anything out right now in this disaster is referring people to 211.
Yes, I mean, we are just every single day. I mean, we have people on calls trying to get the latest information. You know, we're continually asking our partners in the communities that we serve to, you know, make sure that they're updating their information. We give them a different option of, you know, doing it online versus a conversation, because a lot of times we call because we want the detail and to understand, you know, what all they're doing service-wise. So we've asked everyone that if they have increased or changed up their services to make sure that they keep us informed so that we can inform the community when they're calling for needs.
Well, my question really is more of, does state mandate allow those child care facilities to exist for essential workers? So it's more of a policy question. Right. And as a foundation, we are willing to fund that for our community. We just need to see if we can do it. So it's a little different than a typical, yeah.
I'm going to reach out. I have a call with Samantha Galloway from DHS. We were working on providing some food to child care centers that aren't at YMCAs and Boys and Girls Clubs.
Christina
and asking them what
is
their
now
need was.
exiting.
So what I'll do is once I talk to her, I'll ask her that question. It's because Justin would be able to interpret that policy better than me and see what I can find out, and I can circle back with you.
And
Okay,
they are,
thank you.
they're putting, I can tell you Boys and Girls Club, this is where their staffing numbers have increased. They can only have no more than 10 in a classroom, and so that includes whatever staff need to be in that room. So sometimes it's 8 children and 2 staff. That's where you're going to see a lot of increases in salaries and compensation.
Correct. Yes. Thank you.
And Mike just shared that, I don't know, Kathy, if you saw the Oklahoman today, but it listed, it going through the governor's directive, it listed what the essential and non-essential, and it also included a place to go if you needed to apply for something different. Some kind of, so exactly this situation. So you might take a look at that article if you haven't also, but my guess is Cassie's comment and direction going straight to Justin at DHS might be a little more efficient, but those are a couple of different avenues for you that you might take a look at.
Okay, thank you.
You bet. Okay, anything else for our call this morning? Again, I want to thank the panelists for sharing your expertise, for taking time out of what I know are some very, very busy, hectic days. And funders, thank you for your time, and I'll be in touch with thoughts about our next call. Keep doing great stuff, everybody. Our state depends on it.
Thank you so much.
Thanks, Teresa.
Thanks, Teresa.
Thank you.
Multiple people are now exiting. Multiple people are now exiting. Multiple people are now exiting. Multiple people are now exiting.
Probably.
Is now exiting.
Carrie Blakely.
Is now exiting.
Kim Henry
Is now exiting.